So without wasting much time, I would like to invite our first speaker for the advanced lung cancer session on EGFR mutation positive lung cancer, which is first-line EGFR therapy or long-term data. And I would like to invite our first speaker, Dr. Satvik Khaddar, who is a medical oncologist from Indore, who will be speaking on the long-term results of the Gefitinib versus Gefitinib plus chemotherapy trial.
Thank you, ma'am, and good morning to everyone. So I'll be briefly discussing about the landmark TMH trial, the 5-year data. So just a background, this was the Gef versus Gef plus chemo trial in EGFR mutated lung cancer, and it was published in 2019 in JCO. In the first publication, they reported median PFS benefit with of 16 months in Gef chemo versus 8 months in Gefitinib arm, with a hazard ratio of 0.51, and the about the OS data, it was not reached in the combo arm versus 17 months in the Gefitinib arm. So just a brief background, they included EGFR positive patients, exon 18, 19 and or 21, stage 3B onwards, not amenable to radical therapy, or stage 4 and up to PS2. Brain mets patients were also included. Total 350 patients were there, and they were randomized in 1:1 fashion. So talking about the long-term results now, after median follow-up of 5 years, the median OS reported was 17.6 months in the Gef group versus 27.5 months in the Gef plus chemo group, which was significant. So almost 10 months absolute improvement in the overall survival. And talking about the 5-year OS, it was 4.42% in the Gefitinib group and 13% in the Gef plus chemo group, which was also significant. So you can see the long-term graph, the separation which was maintained in Gef chemo versus Gefitinib. The 5-year PFS was 7.1% in the Gef group versus 6.67 in the combo group. And they also analyzed that repeat tumor biopsies and molecular testing was performed in 117 patients, although the analysis was not published. Talking about the subsequent therapies, this is the details of treatment received according to the lines of therapy. So more number of patients in the Gefitinib alone group received subsequent therapy, 74% patients versus 57% in the combination arm. So to summarize, this trial found that PFS and OS benefits of adding chemotherapy to Gefitinib were sustained at 5 years, and which confirmed the earlier publication. There are other studies which have explored this strategy of adding chemo to TKI, the Japanese trial 009, the GAP-BRAIN, and FLORA-2 recently we know, which has added chemotherapy to osimertinib. All have reported a PFS benefit, and OS was reported in NEJ 009, GAP, and this study. FLORA-2 results are still immature for OS as of today. Some limitations: that access to osimertinib was limited post-progression. However, this reflects the general population we see day in, day out in our clinical practice. And it is precisely in this situation that adding chemotherapy to Gefitinib improves outcomes. So basically this trial holds a lot of importance in our day-to-day clinical practice in India, and that is why the results are important. Thank you.